So when I have to see a new provider, I have a lot of anxiety. A whole lot. It's scary because you want to be on top of your health, but you, at the same time, don't want to deal with anybody who doesn't care about you.
No person wants to go to the doctor and be scared. And so what can you do as that medical professional, that medical provider, to help that individual feel better about the whole thing?
When I'm looking for a new provider, there are a lot of things that are important to me, such as what they specialize in.
Someone who knows about transgender people. You know, someone who has the knowledge, and not only a provider, but the whole team. You know, since the first moment you get into a place, you know, from people at the front desk, and you know, that environment where people are in touch with who you are and respect you as a person.
A really good health experience for me is a doctor not just looking at your chart, but really reading it. I know it can be hard, but just maybe knowing my name, my age, you know what I'm saying, and my pronouns might just be enough.
Don't misgender people. If you're not certain, ask. 'Cause most of us are not uncomfortable with giving you our pronoun preferences. So just ask if there's any question. And then once you get the information, use it.
I think what's also important in terms of what providers can do is they can do some simple things, such as putting the actual information, creating the lines, literally putting the lines on their forms that say simply your preferred name or your preferred pronoun.
I understand if on the paper you have to do my legal name. I get that. But you don't have to address me that way. That has nothing to do with our interaction. So just, you know, ask the questions, use the information.
One of my themes that I try to incorporate wherever I go is the concept of excellent customer service. If you are providing me excellent customer service, the other things really are irrelevant. When we see it, that looks like a great experience at the front desk. It means when I go to the restrooms, they might say gender neutral or family restrooms, all the way to when I go into the back and I'm sitting with the physician or I'm getting my pressure taken from the nurse. All those conversations and all of that experience is a wonderfully positive, affirming, and supportive type of experience.
Get to know me a little bit. I want to tell you all my business. I want to trust you with it, but it's not in my nature to just meet someone for the first time and blat out all my business. So like, allowing me to feel comfortable with you, asking the proper questions, knowing that I am trans and being okay with that. And sometimes asking some trans-specific questions. I
think there's a general conversation that could be had about trans people in general, and our sexual habits, our sexual health. But there's also separate conversations that need to be had for trans men and trans women.
So like, I want doctors to be mindful that, hey, just because you're trans doesn't mean that you don't go through either or experiences. It means that you go through both of them. You know, so like you have to check me for testicular cancer, and you also have to check me for breast cancer, you know? So like, being knowledgeable about that and being okay and confident, doctor, I need you to be confident when you're asking me these things because I'm going off of you.
It's important for providers not to make assumptions based on sexual identity, gender identity.
You can't put us all into one group. Some identify as gay, some identify as bisexual, some identify as straight. And then the sexual practices associated with that are different, which means our risk levels are different on an individual basis.
It's okay to know I'm a trans woman. I think that that's the biggest thing. It's okay to know. I'm not going to be embarrassed. In fact, I would like for you to know, so that way you can ask the tough questions that aren't being asked when people just automatically think I'm a woman. I want you to ask me, have I thought about castration? Have I did breast augmentations? I want you to ask me these things.
Ask a transgender woman or man, you know, have they had any silicone injections? Where do they get their hormone replacement therapy if they say that they've been on it, but this is like one of their first doctor's appointments? I mean, because if they're on the street, is it pure? Has somebody else used it? Are the needles clean? I mean, all of that comes into play too, which increases their risk for other things.
I should be able to go to my doctor and ask about fillers and injections and things of that nature, and them be knowledgeable about it, or send me to a facility that can provide those things for me.
Education is the key. You know, I think we are a community that is growing, and they need to know, they need to learn about us. It's not up to transgender women or people that to educate or to teach anything to medical providers. It's up to them to learn about us, because you know, we all deserve equal and a good, excellent health care.
The experience of the trans community, while on certain levels is unique to us, it's good practice that whomever your patient is that's sitting across the desk from you, that you speak to them respectfully, that you refer to them in the way that works for them, that you do everything possible to help them have a safe, welcoming, warm, wonderful experience.